Good afternoon. I am Andrea Chisholm with the Midday News. A special welcome if you're watching on onespotmedia.com. Despite the health minister's declaration that Tuesday's case at the University Hospital of the West Indies was not a suspected corona case, members of the opposition took him to task on the issue during yesterday's sitting of the House of Parliament.
The University Hospital prior to coming here, and several of the persons there are wearing masks and all of those things. So certainly those persons have the impression that there is something going on.
The straight, simple answer to that is that we're acting out of an abundance of caution, and that's the responsible thing to do.
Dr. Campbell also questioned the state of the health sector given the patient's history. The patient traveled from China, arrived in Jamaica 14 days ago, and now has symptoms.
Tell me, if I did not suspect corona, what is it that I'm testing for? Or is it that there is a misunderstanding as to what the word suspect means? Because certainly when you go to a doctor, there's a whole panel of tests that you could run. But you don't test every patient for everything. You assess them, and based on what your likely diagnosis is, then you investigate along that line to confirm or to rule out. So if a patient who was in China comes to the university having respiratory tract symptoms, and you are going to do a test, you are doing that test because you suspect coronavirus.
Dr. Tufton insists different levels of risk which will attract different levels of responses. But Dr. Campbell had a different opinion on the matter.
Information is that you have two persons that returned from China on the 13th of this month, and in keeping with that 14-day period that they started displaying symptoms last night and went to seek care. What are the different protocols and procedures that were put in place at the University Hospital to treat with this matter?
The acting chief medical officer, Dr. Karen Webster-Carr, has responded to concerns raised by the NAJ president about surveillance activities at the country's airports. On Monday, Mrs. Carmen Johnson said the screening process for fever is complicated, but the nurses have no digital thermometer.
We don't really recommend the personal touch. So what we have is the handheld scanners. And while the one at Norman Manley, provided by Health, was stolen, we do have access to the others at the airport. So there is thermal scanning done as well as handheld scanning. There is that possibility if we need it. So we are working to replace the ones we had in Health.
Dr. Webster-Carr also insisted that adequate measures are in place for nurses at airports to do surveillance.
Airport, you do notice that the public health nurses walk the line and just check your immigration particulars to see if you gave a history of coming from any place of interest. And so the staffing that is there at the moment is adequate because it's a referral system. And many of us travel elsewhere. Have you ever seen public health persons from any other country? You are referred. So you are questioned by border security and then referred as necessary.
The government is ramping up its vector control efforts to contain the dengue outbreak. 10 new vector control vehicles were handed over to the Western Regional Health Authority. Speaking at the ceremony yesterday, Regional Director Errol Green said the vehicles will be assigned to the 4 western parishes.
2 Mitsubishis and 8 Toyotas. 3 pickup trucks will be sent to the parish of St. James, 3 to the parish of Westmoreland, and 2 each to Trelawney and Hanover.
Almost a month ago, each of the 4 parishes received 2 new vehicles. Mr. Green said the purchase of the vehicles is one of the greatest investments in the health sector. He is therefore cautioning parish managers for health to ensure they are maintained.
I'm going to be asking that the maintenance schedule for these new vehicles be dutifully adhered to. If you don't maintain them, in less than no time, they will pop down. The machines that are mounted on the back, they should also be maintained as well. We do not want to find ourselves in a situation where we spend so much money to mount these things on the vehicles, buy brand new vehicles that are not maintained, and when you hear from the show why the vehicle isn't working, it's because the machine breaks down.
RJR 94 FM is now Radio Jamaica. The company says the rebranding initiative is part of its strategic focus to improve radio services, which will now be driven by technology. TVJ's Andrew Ladley was at the launch.
After 70 years of iconic service, RJR is repositioning itself as Radio Jamaica. Now, standing by to speak with me about the rebranding is the General Manager for Radio and Television Services in the RJR Gleaner Communications Group, Mrs. Claire Grant. I'm going to invite her to speak with me. Now, Mrs. Grant, why is it important that the RJR repositions itself as Radio Jamaica now?
Well, we've looked at a couple of things, looked at a lot of things to do with the brand and looked at a lot of things to do with the industry of radio in Jamaica. As the very first commercial radio station, we think it is time for a number of things to change, and that includes ourselves. So RJR is now your Radio Jamaica, and in that is something that we hope to be a catalyst for change, because as our new tagline says, we're active for the good of our country.
What are some of the other important aspects of the rebranding that you think Jamaicans should be aware of?
Well, certainly we're embracing the technology, right? So our calendar, which is a remarkable calendar, we're very, very proud of it, also has QR codes that allows you to hear the actual moments that took place so many years ago. The first broadcast, that famous fight between George Foreman and Joe Fraser, the raising of our flag, the very first raising of the flag, and of course, Millie Small, My Boy Lollipop. So that is just a taste of what is to come in the future for Radio Jamaica.
All right, there you have it, General Manager for Radio and Television Services in the RJR Gleaner Communications Group. And of course, we'll continue to track the developments in the Radio Jamaica rebranding.
Thank you, Andrew. And it's time for a break, but stay with us here on the Midday News. We have more stories right after these messages. Welcome back, and we're continuing the news. Cane cutters who were made redundant and small farmers will benefit from a $200 million assistance program. Given that the demand for sugarcane has decreased, Agriculture Minister Audley Shaw says more needs to be done to help small farmers improve the industry.
During a meeting at the Golden Grove Sugar Factory in Duckenfield in St. Thomas on Friday, Agriculture Minister Audley Shaw assured farmers that the funds will not be given to farmers to squander.
That $200 million is not going to put in your hand to go to the shop. It's going to go into your hand to go into the ground. You understand me? Because handing out money, trust me, carry you till next week or next month, not going to solve the problem.
He noted that while some of the funds will be distributed to cane cutters who were recently made redundant, the rest will be used for planting new crops.
The majority of that $200 million is going to be used to assist you to start planting other things. You understand me? You'll come in the form of inputs, fertilizer, seeds.
Meanwhile, he encouraged farmers who need land to come forward. He advised them to present their plans to the Rural Agricultural Development Authority, which will share them with the ministry.
You realize that we are in crisis, and God knows you need the help. You need the help. And we have as a government, we must find a way to help you because you're not lazy. You're hard-working people. So the ones of you who want to take responsibility for a 5-acre or a 10-acre land, let us know.
The Golden Grove Sugar Factory was closed in 2019 by manufacturing company Seprod, which took over the business in 2009 with the hope of reviving the ailing sugar operation. Andrew Laidley, TVJ News.
Minister without portfolio in the Office of the Prime Minister, Mike Henry, says more should be done to reduce the impact of climate change. He was speaking yesterday at a contractors and consultants seminar hosted by the Jamaica Social Investment Fund. Mr. Henry says at least 80% of the economy is at risk.
Shortly, because we fail to recognize that 80% of our economy lies along the coast. And if 80% is wiped out, if indeed tourism, which the minister is doing such a great job, is damaged, then the growth and the development will also be affected.
And time now for a preview of what's coming up in this evening's Health Report.
In the next edition of the Health Report, we look at the new coronavirus.
We know that there is some spread from person to person based on their testing. They don't think that there's a lot of potential for direct person-to-person spread like we had with SARS, which if you had limited contact, you could still catch it very easily. With this one, they think you need closer personal contact.
That's the Health Report this evening in Primetime News. And now for today's healthy living tip. Wash your hands often with soap and water for at least 20 seconds. Avoid touching your eyes, nose and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. And cover your cough or sneeze with a tissue. Then throw the tissue in the trash.
And in sports, head coach of Jamaica's Rugby Sevens team, Stephen Lewis, says he's confident about their chances of advancing from their group in the inaugural Challenger Series in Chile next month. The Crocs have been drawn in Group B alongside Hong Kong, Colombia and Papua New Guinea.
Absolutely. I think we've been quite fortunate. We've avoided some of the bigger names, Japan, Tonga, Chile. So we have a good chance to get out of this group. Hong Kong will be tricky. They're a professional team. They're full-time. Colombia and Papua New Guinea, I think we can take both of those and we give Hong Kong a good game. Top two go through, so we just need to get out of the group and then it's all to play for.
Lewis also sees the competition as valuable preparation for the intercontinental playoffs for the Olympic Games.
The key thing this year is still the Olympic qualification repechage tournament in France in June, as you say. So that's the main thing. This is fantastic because it gives us 10 days together, almost like a professional team. We eat together, we train together, we play in 2 tournaments, so it will really help our preparation prior to that.
The first leg of the series will kick off from February 15 to 16. And that's the Midday News. I'm Andrea Chisholm. Join us at 7 for the Primetime News package. On behalf of the news, sports and production teams, good afternoon.